Part B. You hear a doctor talking to the daughter of a patient from an aged care home. Now, read the question.
Hello, Mrs. Cox. Come on in and sit down.
Oh, thank you.
How are you today?
Oh, fine, thanks.
And how's your father doing since we last spoke?
Oh, up and down. I'm still finding he seems to be getting increasingly forgetful and he confuses easily, and this makes him really frustrated.
Right. So, as you remember from last time, we did a range of tests on your father.
Mm-hmm.
And based on those results, it does look like he's developed an early onset Alzheimer's disease. So that would probably account for his memory loss, his feelings of hopelessness and his anger at times as well.
Well, what do you think the next step is then?
We can't do a lot about his memory, but we can help him to change his mood and enjoy life more. There's some good medications around, and that may slow the deterioration. I think it's important that he goes back to the aged care home and finds some enjoyment in the activities that they do. It's difficult to determine the long-term outlook, but we'll start him on the medication and we'll check on him again in a couple of weeks to see how he's going.
Okay, thank you, Doctor. I'm grateful for all your help.
Listening Part B. You hear a consultant giving a talk to a group of trainees. Now, read the question.
The first 24 hours after a head injury are the most important, although after effects may appear much later. It's important that the patient is woken every 2 hours for the first 24 hours. If they're recovering at home, then this should be by someone responsible who is able to also watch for the following symptoms: persistent headache, nausea, or vomiting, weakness, numbness, or paralysis of the arms or legs, blood or clear fluid coming from the ears or nose, blurred vision or one pupil larger than the other, and convulsions. If any of these occur, then the person will need to call their GP immediately or return to the hospital emergency department.
Listening Part B. You hear a vet talking to a client who brought his pet cat Jimmy to the vet clinic. Now, read the question.
Okay, the examination has revealed large amounts of struvite crystals in Jimmy's urethra, so that's why he's had difficulty urinating. The good news is that there's no bladder stones and no major blockages.
Oh, that's good.
And his kidneys are fine, so there's no evidence of damage.
Oh, that's great.
Yeah, but I need you to understand that this condition is very painful and distressing for Jimmy.
Okay, right.
So, it's certainly a significant problem at the moment, and he'll continue experiencing difficulty in urinating. And for male cats in particular, there is a risk of developing a urethral obstruction, which can be fatal.
How do we make sure that doesn't happen then?
Well, we can make some dietary changes, which will definitely help. But I'd also like to know if Jimmy's been feeling stressed at all lately. Have there been any changes in his living environment?
Well, we have been doing up our house at the moment.
Ah, that could do it. Stress is definitely a contributing factor with this condition.
Listening Part B. You hear the nurse unit manager discussing the progress of a patient at a multidisciplinary team meeting. Now read the question.
Now on to Margaret Smith. She's a 68-year-old woman who was brought into ED 2 days ago by her son Jeff. Margaret was diagnosed 4 years ago with frontotemporal lobar degeneration and has progressively deteriorated in that time. She also has hypertension and depression. Her GP recently started her on an antidepressant medication. She lives at home with her son, who's her sole full-time carer, but nursing staff have been unable to contact him since her admission to hospital. Margaret's shown changes in her social behaviour recently. She's been declining food at home, and on the ward the nurses have reported she's holding food in her mouth. She's refusing to take medication. She's been very agitated on the ward, and she's yelling out when nursing staff try and assist her, and she's been confused and physically aggressive on occasion. She's also calling out regularly for her son.
Listening Part B. You hear a radiographer talking to nursing staff at an aged care centre. Now read the question.
The most important preparation requirements include obtaining a recent EGFR result and providing details of current prescriptions, over-the-counter medications, and information on pregnancy status. Please also ensure that patients follow a hydration fast for 4 hours prior to examination. Patients with a recent history of fever, diarrhea, and dialysis are not suitable to undergo CT scans with contrast use. The examination takes between 10 and 45 minutes depending on the procedure type, and possible side effects include nausea, vomiting, and dizziness. The CT contrast usually stays in the patient's system for 48 hours after the injection, and following the examination I recommend advising patients to drink plenty of extra water, as this encourages secretion of the CT contrast media. Finally, if any complications such as allergic reactions, decreased urine output, confusion, or blood in urine occur, then please inform your patients to let medical staff know as soon as possible.
Listening Part B. You hear a GP discussing psoriasis with a patient. Now read the question.
You've got something called chronic plaque psoriasis on your elbows and knees, but don't worry, we can treat it. You definitely benefit from some light treatment to help your rash settle down. I'd recommend coming up to the physiotherapy department twice a week to have UVB light treatment.
Are you arranging me to have sunbed treatment, Doctor?
Well, there are some similarities to sunbed treatment, but actually the lights that we have in hospital are special and they emit only a UVB light. You will get a suntan though.
Sounds great. When can I start?
There's a bit of a waiting list, so I'll give you this cream to be getting on with first. Take the form to the physiotherapy department and they'll book you in for 6 weeks of UVB treatment. All the best then.
Thank you.